Good morning, everybody, and you're very welcome to the Ireland East Hospital Group UCD NDGP Grand Rounds, something we do on the last Friday of every month. And this one is slightly different, so promises to be very interesting. We're going to talk about we're going to hear presentations from the AHSS grant awardees. And just to talk a little bit about it, the UCD Health Affairs AHSS grant aims to enhance the collaboration between IEHG, its affiliated community health organizations, and UCD College of Health and Agricultural Sciences. So we aim to raise the awareness of UCD Health Affairs and to foster synergies between UCD CHAS, UCD Health Affairs, IEHG, and its affiliated community areas. And there's an annual call for applications in January of each year. This year we received 28 applications, and the AHSS grant was awarded to 4 projects, 25,000 each. So we'll have the 4 successful projects for this year, and we'll have 1 from last year. And the grant is really to support health and science related research, educational innovation projects that clearly will enhance the concept of an AHSS, and they will align with key college and school research and our education strategy objectives. I'm delighted to introduce Professor Aisling Mulligan, Consultant Child and Adolescent Psychiatrist, Clinical Professor in Child and Adolescent Psychiatry in UCD, and an old classmate of mine. So she works with HSE in Grange Gorman and with UCD, National Clinical Lead for ADHD in children and adolescents. She has research interests in ADHD, development of mental health assessment tools for children, Director of the MSc in Child Art Psychotherapy run by UCD. And from that, she has liaised with child art psychotherapists to develop mental health self-report assessment tool for young children. This led to development of the digital mental health assessment tool called telTaz. Thank you very much, Aisling.
Thank you. I'm going to try and share my screen now as well. Can you see that? So just to talk about the telTaz digital mental health assessment tool that we've been developing. Now, as I'm sure you are aware, there is a difficulty at the moment with children's mental health. So there are a lot of children to be assessed very rapidly. We have developed a digital mental health assessment tool called telTaz for screening children's mental health in a trustworthy and evidence-based way. So our mission is to identify children's mental health symptoms early so that we can get and intervene at the right time with the right help with better outcomes. 1 in 5 children have a mental health difficulty, and many of these children are not treated and they just manage. So what we would like to do is to target the right treatment to the right children. Recently, we've actually had a 33% increase in referrals to CAMHS since COVID has happened. We've also got, at the moment in Ireland, there are about 11,000 children on primary care wait lists. They're children who may not have major mental illnesses, but have some difficulties which need to be addressed. And it's children like that that we would like to help with our telTaz mental health digital tool. It's a tool that's geared at children in the primary school age group. Now, 70% of young people who experience mental health difficulties have not actually had appropriate interventions at the right time or at the right age. So we're hoping that by developing this mental health tool, we'll be able to increase the amount of children that we can work with and address. And that early detection is, of course, the key. Like every illness in medicine, early detection is the key. There's a global shortage of mental health professionals. So some digital tools such as telTaz will, they will help us to access more children. So the current screening tools, a lot of people say to me, well, what's wrong with the current screening tools, or what's different about telTaz digital mental health assessment tool to the current tools? Well, I have a picture there of 3 of the current tools that we sometimes use in CAMHS clinics. And as you can see, they're very paper-based tools. Most of them for primary school children, we actually ask the parents to complete a tool. So it's a black and white form, or sometimes it's a form that's got an awful lot of writing on it. Some of the families that we work with have literacy difficulties. We may have people coming here from other countries, and maybe they didn't plan becoming a refugee, so they're coming with the wrong language or limited English. So filling out these forms are quite difficult for parents and for children. Children lose concentration. The children who need to come to CAMHS are not always the ones who've got good reading skills. There is also a difficulty that the analysis of forms is very time consuming for professionals. So actually, a lot of the time we actually don't even use the forms because, you know, it just slows up your work, and it's not actually quite a, you know, it's not good for the patient, the doctor-patient relationship and the therapeutic relationship. So our solution, we've developed initially a form that's an improved form. You can see it on the left, the My Feelings form. It's developed with emojis, and it was also developed with healthcare professionals. We did some focus groups to find out what were the most important items to put on the form. So we've got 14 items that probe about mental health or psychological distress in children. We developed which were the most important 14 items with a focus group of mental health professionals, and also working with parents and children. And then we put those 14 items on the form, but used emojis with a Likert scale for children to identify how difficult or how much of a problem they have. So they score their difficulties 1 to 5 using these emojis. And then we also we supported some of our questions with cartoons. So you can see 2 of the cartoons there. I can tell someone how I feel. And another one is, I hurt myself on purpose. So that question, I hurt myself on purpose, is obviously a crucial question in child and adolescent mental health. So it's the inclusion of that question that turns this form from being just something that kids complete it turns it into a mental health assessment tool. Having that question, I hurt myself on purpose, means that we are identifying true psychological distress that's of relevance to mental health professionals. And it gives me the ability sometimes to discharge people quite early if they can say I hurt myself on purpose is actually at 0 level. So this is a form that can be quickly and easily completed by children in the primary school age group. And then our next thing was to change this to a digital tool. So we linked with people from DCU, the School of Computers, and they very happily, nicely put it onto a digital tool. So we have an app or a digital tool that's accessible on a phone or on an iPad or a computer. But the idea is that it's always started by the use of it is stimulated or commenced by a mental health professional, a doctor or a therapist. You can see the paper-based form on the left-hand side there again. 14 questions on anxiety, low mood, daily functioning and risk to self. And this is our digital solution. And just to say, what is our AHSS grant about? So we had already produced the form and published the form in an international journal. We'd published the use of the form in a general school, full school, and we'd also published and compared it with the use of the form in a CAMHS clinic. So it's at a mental health level, and it's useful to identify children with true psychological distress from the general population. So we've proven that. And then we had also developed the app, but what we need to do is to test the app further in CAMHS clinics. So what we did was we linked in with a number of child psychiatrists nationally in the IEHG group, and we linked in with a number of pediatricians in the IEHG group. And just to list them out, the people we're listed with is especially Dr. Alfonso Rodrigo Herrera in St. Luke's Hospital, pediatrician, and other pediatricians were linked with our Professor Farhana Sharif in Mullingar Hospital, and Dr. Maybelle Wallace in Wexford General Hospital, Dr. Charmaine Van Heerden, pediatrician in Wexford General Hospital. And we're also linked in with child psychiatrist Caroline Noon in Longford Westmeath, and with Dr. Peter Fitzpatrick and Dr. Peter Braben, both in CAMHS in Kilkenny, and Dr. John Fagan in CAMHS in Wexford. And all of this project has also been facilitated as well by child art psychotherapist Anne Coffey, who's here with me today, and child art psychotherapist Maria Joyce, who's not here today, but they've been involved in the creation of the telTaz app and the My Feelings form. But what we're actually going to do now is we have our ethics approval to do a usability study using the digital telTaz app in the CAMHS group and actually in pediatric groups as well. So we have that ethics approval through UCD Ethics Committee, and we also have the ethics approval with the HSE Dublin North City and County CAMS. So we had both of those ethics approvals prior to applying for the AHSS grant. And we planned simply doing a usability study with about 30 children and families in the pediatric and CAMS clinics, and getting feedback from the parents, from the children, and from the healthcare professionals about using the app, you know, and what it's like to use, and to observe the child, the parent, and the healthcare professional using the digital mental health assessment tool, and to do a brief interview with them following that. Now, it's planned that this usability study will be used to upgrade the app before we go on to do full validity studies with the app. So we will progress on after that to full validation studies. But we would like to get, you know, find out what are the glitches in the app before we progress to full validation studies, so that when we have it validated, we validated the final tool. So I think that's really most of my presentation. Just to show you as well, it's all about stay left, shift left. So it's a tool that will help us to detect early, intervene early, and that should, you know, take the burden off the healthcare service. So the use of the telTaz app in CAMS or in primary care or in school settings should help people pick up difficulties early and intervene early, so that down the line it should reduce the number of children presenting to CAMS with very serious illnesses. It will help children communicate about their difficulties, so that they can get care early, or so that they can even communicate through to people who are in their world already with their teachers or their parents. So just to say, at the moment, telTaz will always be held in the healthcare setting and initiated by a healthcare professional or a teacher. So it's not planned that this will actually go out to the general community. It's planned only for use in healthcare settings. So I think that really concludes my my talk. This is a little bit about our timeline, and I'm open for questions.